If you have an L4, 5, S1 bulging disc, your number one goal of your homework is restore the global alignment over the disc and the spinal joints so the disc and those joints can heal up properly and get some long-term changes and feel great. In this video, that's exactly what we're going to cover. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. Before you try any of these exercises, make sure you check with your healthcare provider to make sure this is correct for you. First step is to warm up. Very important step to get the blood flow in the area, push out the waste products, get it prepared for changing the structure of the spine for long-term changes. So the first exercise that we're going to do, lateral planks, hold for 10 seconds and do 10 repetitions. Abdominal curl-ups, you want to get a small towel, put it underneath where your belly button is lined up with the belly button so it keeps the lumbar curve. You want to brace abdominals. Reach, bring it chin to your chest. You want to hold this for a 10 count and do 10 repetitions. Bird dogs, you want to brace abdominals. Extend out from your heel and your hand. Keep the back flat. You want to hold for 10 seconds and relax. Do 10 repetitions on each side. Glute bridges to strengthen up the glutes. Dig the heels into the ground, lift the toes, brace abdominals. 10 to 20 repetitions of glute bridges. Next exercise is to provide motion in the lumbar spine. So you want to get a nylon strap like this. I use my surfboard strap that I use to strap down the boards on my car. So it has a nice little lock in here. And you can tighten it up. You come in here, you want to get a pull, get a chair, you want to sit in a neutral posture on your sit bones. You don't want to be flattening out your back. You're going to place a strap right over the iliac crest in between the ribs at the lowest point, so about your L4 area. And then you can use this. I like this because I easily tighten this up. So it's nice and firm. And then I press back this direction. So I'm putting pressure right on that joint here and the muscles around it. So it's compression. So I brace abdominal muscles, and I want to work flexion and more extension. Get that extension back in there. And we want to perform this flexion, extension, more extension, about 50 repetitions. Next, you're going to do lateral bending. But as you do the lateral bending, you want to bend side to side, keeping pressure on this area here. That means you're going to be pushing back once again. And you want to laterally bend, and you want to do 50 repetitions. Now, if any of these are creating shooting pain down the legs, of course, you're going to stop that. A little bit of discomfort's okay. Now you want to perform rotation. So you want to bring your elbows up, brace abdominals, keep the pushing back, so keep compression on that area, and do a slow, steady motion. Now, since the spine is totally warmed up, now you're ready to get some molding into the spine. So now you want to lay on your belly, prop your elbows underneath so your elbows are straight underneath your shoulders. And now you want to get the tension over time, so you can actually change the spine, because you want to get this in this pose for a minimum of 10 minutes. And it's important because the 10 minutes allows that steady tension, allows for the ligaments and the disc to have a viscoelastic deformation of that area, because a normal lumbar spine has about 75% of the weight on the disc and 25% on the back facet joints. People that have disc bulges typically have more of a flat back, and it pushes that flat back, puts a lot of weight on the disc, so it pushes it back into the nerve. So we have to change that dynamics, and this is what's going to do it. So we warm up the spine very well. We get into this posture here, and you can sit in this for 10 or more minutes. You can sit here and text, you can scroll, you can watch TV, read a book, listen to a podcast. You just want to get the tension over time to get that change in the ligaments and the disc to make the long-term changes. You want to perform these exercises minimum once a day, twice a day would be great, for a minimum of 6 weeks to get those changes in the spine.